Next route is sublingual route. In the sublingual route, tablets placed under the tongue or between the cheeks. Drug should be liquid, soluble and small. In this route, the tablet is placed under the tongue or in between the cheeks, but the drug should be in liquid, soluble and small in form, so that the drug melts on its own, and it is also a easy method to take the medicine by the patient. Now next is advantages of sublingual route. First, rapid absorption takes place. Absorption of medicines taken by the sublingual route is done quickly and fastest method. Next is drug is dissolved easily. The medicines get dissolved quickly and easily. Last, drugs enters into the blood directly. The drug that is given soon directly enters into the bloodstream. Now next we will talk about the disadvantages of the sublingual route. First, this method is inconvenient because if we talk about the disadvantages of this route, then this method is inconvenient because we have to keep the medicine under our tongue or in between the cheeks for a long time to dissolve the medicine. Next, irritation of the mucous membrane. Irritation of the mucous membrane might be occur when we keep our medicines under the tongue for a long time. Our mucous membrane will get irritated that time. Next, person may swallow the drug. What happens when we keep the medicines under the tongue for a long time? This route has the highest chances of swallowing the medicine. Next, we will talk about the rectal route. Certain irritant and unpleasant drugs can be put into the rectum, for example, suppository and retention enema, recurrent vomiting or unconscious, diazepam, indomethacin, and paracetamol. When we choose to give some medicines through this rectal route, because some medicines are irritant or unpleasant, so we cannot give through the through any other route, so we can choose this route. Suppository or retention enema are in the example of this route. When the patient is vomiting recurrent or repeatedly, or patient is unconscious stage, then medicines are given through this route. Next is advantages. If drug is irritant, if a patient is unconscious, or if a patient is feeling of nausea and vomiting. Here we talk about the advantages of this route. We should select this route only then when drug is an irritant, or the patient is unconscious stage, or maybe patient feeling the nausea and vomiting, then we can select the rectal route. Next is disadvantages. First is feeling of embarrassment. The patient feels embarrassed by the giving medicines through the rectal route. And its second advantages is that medicines are absorbed slowly through this route.